wounds themselves are not a direct symptom of Parkinson's disease (PD), but several factors related to PD can increase the risk of developing foot problems, including wounds. Here's how Parkinson's may contribute. Hashtag #PaperSyn1. Mobility and balance issues. People with gait disturbances. People with PD often have a shuffling walk, which can lead to tripping, falls, and foot injuries. Postural instability, poor balance, increases the risk of falls, which may cause cuts, bruises, or ulcers on the feet. Hashtag 222. Muscle stiffness and dystonia for rigidity. Stiff muscles, especially in the legs and feet, can cause abnormal pressure on certain areas, leading to calluses or sores. Dystonia, toe curling or cramping, involuntary muscle contractions, can cause friction in shoes, increasing the risk of blisters or ulcers. Hashtag Gepgatry. Peripheral neuropathy, less common in PD, but possible. Some people with PD may develop neuropathy nerve damage, reducing sensation in the feet. This can lead to unnoticed injuries or slow healing wounds. Hashtag Gersmorsyn4. Poor circulation and swelling. Reduced movement due to PD can lead to poor blood flow, increasing the risk of slow healing wounds. Hashtag NPRI5. Medication side effects. Some PD medications like dopamine agonists may cause edema, swelling in the feet, which can contribute to skin breakdown. Hashtag prevention and management. Supportive well-fitted footwear. Supportive well-fitting shoes can reduce friction and pressure. Regular foot inspections. Check daily for cuts, blisters, or redness, especially if sensation is reduced. Physical therapy improves gait and balance to prevent falls. Moisturizing and foot care prevents dry, cracked skin that can lead to wounds. If foot wounds develop and don't heal properly, consult a podiatrist or neurologist, as untreated wounds can lead to infections or complications. Would you like advice on specific foot concerns related to PD? Sent from my iPad. Vacuum therapy, also known as negative pressure wound therapy, NPWT, or vacuum-assisted closure therapy, can be highly effective in healing certain types of foot wounds, particularly chronic or complex ones. However, its effectiveness depends on the wound type, underlying conditions like diabetes or Parkinson's-related mobility issues, and proper application. Hashtag Shess and how vac therapy works. A vacuum device applies a controlled suction to the wound, which 1. removes excess fluid and infection, reduces swelling and bacterial load. 2. Improves blood flow, stimulates tissue growth and oxygenation. 3. Promotes granulation tissue formation, helps close the wound faster. 4. Keeps the wound edges together, reduces strain on the wound. Hashtag effectiveness for foot wounds. Diabetic foot ulcers, NPWT, is well supported by research and often used when standard care fails. Pressure ulcers from immobility, e.g. in advanced Parkinson's, can help if offloading is also addressed. Surgical wounds, e.g. after debridement or amputation, speeds recovery. Venous or arterial ulcers, less effective unless circulation issues are managed. Hashtag and limitations and risks. So, for all wounds, contraindicated in untreated infections, exposed arteries, nerves, or certain ischemic wounds, and requires proper care, must be monitored to avoid skin irritation or infection under the dressing. Cost and accessibility can be expensive and may need professional application. Hashtag and alternatives, if VAC isn't an option. Offloading special shoes, braces, critical for pressure-related wounds. At advanced dressings, hydrogels, hydrocolloids for milder ulcers. Hyperbaric oxygen therapy for diabetic wounds with poor healing. Hashtag intent and bottom line. VAC therapy is very effective for complex foot wounds, especially when combined with good wound care, infection control, and pressure relief. However, it's not a standalone cure. Underlying issues like poor circulation or repeated trauma from Parkinson's gait must also be addressed. Would you like guidance on whether a specific type of foot wound might benefit from this? Yes. Tent wound vacuums, VAC therapy, can sometimes be tenless effective or ineffective in healing foot wounds in people with Parkinson's disease, PD, depending on the underlying complications. While NPWT, negative pressure wound therapy, is a powerful tool for wound healing, certain PD-related factors can interfere with its success. Hashtag CNY. A wound vac might fail in Parkinson's patients. Hashtag poor offloading, pressure redistribution. PD can cause rigidity, dystonia, toe curling, and shuffling gait leading to constant pressure on the wound. Even with a wound vac, if the foot is still under a friction or pressure, e.g. from abnormal walking, healing may stall. Solution: custom orthotics, therapeutic shoes, or a walking aid cane walker may be needed to reduce pressure. Hashtag 222. Circulation and neuropathy issues. Some PD patients develop peripheral neuropathy, nerve damage, reducing blood flow and sensation. If the wound is an ischemic yet a lack of blood supply, a wound vac alone won't fix the underlying problem. That solution, vascular studies, AB Doppler to check blood flow, may need vascular intervention. Hashtag 3. Medication side effects from upamine agonists, e.g. pramipexole, ropinirole, can cause edema, swelling, worsening wound healing. Solution: adjusting PD meds or adding diuretics may help. Hashtag 4. Mobility and compliance challenges. If PD causes severe tremors or dementia, the patient may struggle to keep the VAC device properly attached. Solution: a caregiver may need to assist with dressing changes. Hashtag SANIN 5. Infection risk. PD patients with immunosuppression or poor hygiene due to motor limitations are at higher risk of infections, which can negate VAC benefits. Solution: strict wound care hygiene, possible antibiotics. Hashtag when can. A wound vac still work for PD patients? If offloading is optimized, e.g. wheelchair use, no weight bearing, if blood flow is adequate confirmed by vascular tests, if pipe infection is controlled with antibiotics debridement, if caregivers support us and ensures proper VAC maintenance. Hashtag an alternative or adjunctive treatments. Per total contact casting, TCC, best for offloading diabetic Parkinson's ulcers. Hyperbaric oxygen therapy, HBOT, helps if hypoxia is an issue. Growth factor therapy, e.g. Regranex, stimulates tissue repair. Hashtag set key takeaway. A wound vac was scanned. Help heal foot wounds in Parkinson's patients, but only if PD-specific barriers like pressure, circulation, and medication effects are addressed. A multidisciplinary approach, podiatrist, neurologist, wound care specialist, is often needed for success. Would you like help finding specific offloading strategies or wound care tips for PD-related foot wounds?